foremost, what we've really proven, apart from just anecdotal evidence, right? We have proven that patients with robotic surgery have a 3 to 5-fold lesser complication risk from the same exact surgery that we used to do with an open incision, and a 5 to 7-fold lesser risk for what we call revision surgery. Because it's not uncommon that people have a very successful spine operation and potentially 2 years later they may need to have something else done. Well, we've proven at the 2-year mark that there is a 5 to 7-fold risk reduction in needing more surgery. So it looks like that utilizing the robot, we are just better at the index procedure, providing the patient what they need, so they have less risk of having to go back to the operating room multiple years later. Planning the procedure is key to make it successful in the operating room. So once we identify a patient with a spinal problem that could potentially have a robotic operation, the patient has to undergo a CT scan, which is a very thin sliced, low radiation, but still it's a radiation procedure. It's a low radiation scanning procedure, and based on that scan we're able to plan the screw trajectories and we're able to plan our correction of the spine. So sometimes we have to cut out little pieces of bone and so on, and we plan all that with the robot preoperatively. We make sure that when we put screws in various places that we can eventually connect them with a rod, and all that work gets done beforehand, so we can get very safely then in the operating room into their true anatomy after we have created a virtual model of what their spine is supposed to look like after we're done with the surgery.